On the line now, I have from the Department of Public Health, the Deputy Director of the Department of Public Health, Fran McGrath.
It's actually the Ministry of Health.
Oh, sorry about that, Fran.
And I'm Deputy Director of Public Health. So g'day.
Deputy Director of Public Health. I'm sorry for the confusion. Thanks for coming on the line today.
That's all right. You're welcome.
Now, we're talking about the ever ongoing issue of swine flu and vaccinations and whatnot. Now, I know a lot of people are kind of sick about hearing it, but if you get sick from it, you're going to be wanting something done about it, aren't you?
Well, most people, if they get influenza this year, won't know whether it's the seasonal one or whether it's this new virus. And in fact, the advice is that they should do what they'd normally do with flu, which is look after themselves at home and drink plenty of fluids and take something for a high temperature, and they'll probably need to stay in bed. They should certainly stay away from work while they've got symptoms. But they do need to stay alert for any things like difficulty in breathing, chest pain, a temperature that they can't keep down, that they can't reduce. And if they've got any underlying conditions or they just get more seriously ill, they should call either their GP or Healthline. So
if you're just getting a touch of the cold, no cause for alarm apart from, of course, be careful and wary?
Well, a cold's not flu. Flu normally gives you muscle aches and pains, and I know sometimes people talk about a cold as if it's the flu, but actually they're different. You're sicker with a flu. Important to make the distinction there.
Now, getting on to the issue at hand, yes, the World Health Organization has said today every country needs to vaccinate its populations, and so far the disease has been fairly mild in New Zealand. Regular flu has killed far more people as well, so why is the mass vaccination necessary at this stage, Fran?
Well, New Zealand isn't looking at a mass vaccination campaign. We've got some vaccine that's going to be arriving in country.
300,000 doses, wasn't it?
300,000 doses. Once the clinical trials are completed on that, and once it is licensed, then we'd be taking account of a couple of things. One, what those clinical trials show, and secondly, what the influenza, what the illness is looking like in New Zealand. I think WHO's advice is for the whole world, and certainly for some countries like the UK or the US, they're not in their winter season. They're looking at winter coming up over the next months. And so they're in a different position from what New Zealand is. But actually we've got a lot of influenza about just now because it's winter and we've got this new virus circulating.
Yes, well, the Resident Doctors Association has come out and said a number of healthcare workers are concerned they'd be made guinea pigs for the testing. Now, I know this is quite an extreme kind of question to raise, but I'm considering that the Northern Hemisphere is about to start their flu season, and considering our reputation as a kind of testing ground for other things in the developed world, what's your response to that?
Potentially a bit of a mischievous comment, I would say. Clearly no medicine... the vaccine, and the Minister was very clear about this, and we're clear on it too, this hasn't yet been licensed. The clinical trials are being done, and licensing would need to happen before this vaccine was used. The reason it's been purchased is to have a bit of an insurance policy, that if we started to see a more serious pattern, or if we got a second wave and this vaccine were useful for it, then you would consider whether that would be useful for people. But there isn't any decision yet about who it would be used for. It certainly wouldn't be used in a trial fashion for guinea pigs. The trials would have been completed, and that would have had to have happened before it would be licensed by MedSafe. So it has to go through that licensing process yet.
So what about the trial process? Will New Zealand be conducting any independent trials? Or?
Those trials are conducted by the company. They have to be conducted before it can be submitted for licensing.
Right, okay, so as it stands, it's an unlicensed vaccine.
Yeah, so it's being purchased so that there is some available, but it needs to go through the licensing process.
What is the wisdom of purchasing something before it's gone through that licensing process?
Yeah, well, the Minister talked about that and said it was an insurance policy. And really, it's because New Zealand had to make that decision some weeks ago before this influenza was circulating very widely in the community. And the decision was made that it would be better for us to be in the position of having vaccine and maybe not needing it rather than the other way round.
Okay, and another, again in terms of the testing, Fran, you've said that we're not going to be doing independent tests of it, so how are we going to ensure that the scientists who do conduct the tests are kind of free of any potential conflicts of interest?
The same way as we do for any other medicine, really. That's part of what gets considered by MedSafe. MedSafe is independent. It operates separately and is advisory to the ministry. So those are the things MedSafe needs to consider, and they use independent advisors on that. So that's the evidence that the company has to produce is about all their clinical trials, which look at safety. It looks at effectiveness, like does this need one dose or would there need to be 2 doses of a vaccine to give protection? Those sorts of questions.
Mm-hmm. Okay, now that company you're talking about, is that the company that manufactures the vaccine?
Yeah, when any medicine applies for licensing, when any company applies for licensing, it's the company that's manufactured it that does that.
And who's the company manufacturing the vaccine that we've purchased?
Well, we've got 2 purchase orders in place, and the one that you're probably talking about, the one that you'll have heard about because it was announced earlier this month, was Baxter's. Mm-hmm. Is that the one you're thinking of?
Yes, yeah. Is that the same Baxter that's facing criminal charges in Austria over the vaccine?
There may well be other things going on in different drug companies, and there are often a lot of things happening there.
Lots of things happening in drug companies,
to which
yes.
That would influence how MedSafe would look at the clinical evidence, and the trial evidence is a distinct process.
Right, okay. Well, those people who are kind of in line to get the vaccine, health workers and firefighters and not, I guess they better hope that MedSafe does their job there.
MedSafe has an extremely good reputation.
So you don't think there'd be any conflict of interest?
This isn't about trialling it on frontline workers. Not at all. I mean, there hasn't been any decision, except in general terms, as to who might be considered for the vaccine, and it would be voluntary anyway, so people would be able to look at that. I mean, it's first of all got to go through a licensing process, which is about checking that it's safe, that it does what it says it does, that it's effective, and then that information can be made available to people who would be offered it as protection.
So should it not get the licence, I guess it won't be going out into the public, is that correct?
Licensing would need to happen before it was used.
Right, okay then. Well, thank you very much for your time, Ms McGrath.
My pleasure.
Have a good afternoon.
Cheers.
Thank you.